Snowy. Today our group, Crystal, Jay, June, May, and I, will talk about the leadership roles of nurse and global trends in the care management of patients with respiratory disorder. Before I start, I'd like to explain that because of computer problem, the rest of my group mates can't use their cameras, so they can't show their faces. Now let's start. Our group divided this topic into 4 parts. The first one is introduction, and the second one is a case study. The third one is application of literatures into nursing practice. And the last one is practical challenges. Now let's start the first part, introduction, an introduction to this activity. Chronic obstructive pulmonary disease is a common respiratory disease with chronic airway inflammation and irritable airway obstruction as the main clinical symptoms. The disease is complicated quickly and has a high disability fatality rate. Because COPD patients are forbidden for a long time and suffer from disease, they are prone to produce negative emotions such as anxiety and depression, which affect the diagnosis and the treatment effect. Besides, the patient's reduced degree of cooperation also affects the prognosis. Therefore, COPD is a tricky disease. In 2017, the Forum of International Respiratory Societies released the second edition of the Global Impact of Respiratory Diseases, highlighting the overview of the 5 most common respiratory diseases, as well as the strong discussion of the relationship between respiratory diseases and the environment, emphasizing the importance of prevention. Also in this year, some researchers in the British released their evaluation of the current landscape of respiratory nursing specialists, describing the major organizational and financial challenges facing health services in the organization and location, resources and time issues, respiratory nursing staffs, the aging of the workforce, many of the nurses to do extra work free of charge, and so on. It is true that this literature can let us understand a lot of information, and at the same time, it is of great help to our nursing practice. Now let's start the second part. This part introduces a patient's case to this activity. Now let me introduce the patient first. An 82-year-old male patient, Mr. Wang, presented to the emergency room with severe dyspnea. He said that his breathlessness and coughing episodes had become particularly severe in the preceding 5 weeks, and fatigue, lethargy, chest tightness, accompanied by low fever. Mr. Wang developed chronic cough and expectoration more than 20 years ago, which can be relieved after taking medicines. In the past 8 years, activity can cause the chest tightness, and after rest, his chest tightness can be relieved. Mr. Wang is also a 60-pack-year smoker, quit smoking for 2 months, not drinks alcohol, had an appendectomy more than 50 years ago, and has no family history of asthma, allergy, or cardiovascular disease. Now let's turn to the crystal.
Here are some of the tests and treatments for this case study. The first is physical examination. He is in respiratory distress with decreased breath sounds, abandoned slightly distance, and the whole body mid-repeating edema. Temperature is 37.4, heart rate is 130, and the rate is 26 per minute. The laboratory results, such as the HB, HCT, 钾、钠、Cl、pH、SA-2、PA-2 and PA 二氧化碳。Echocardiography, slightly enlarged left ventricular hypertrophy and wind aorta. He immediately transferred to the intensive care unit. Mechanical ventilation with endotracheal intubation and anti-infection treatment were given, and waiting for further treatments. And the next model is application of literatures into nursing practice. It's meaning that we need to combine leadership roles of nurse and global trends in the care management of patients with respiratory disorder. Okay, the question is, would it be possible to utilize the above literatures in care management of patients in Mr. Wang's case study? Why and how? Answer is yes. It is possible to utilize the two literatures in care management of patients in Mr. Wang's case study, and next we will explain why we say that. The reason 1. The literature provides a broad overview of the global scope and the trends of COPD, the most important pathogenesis factors and potential risk factors for developing COPD, the mechanism of action and symptoms associated with COPD, and approaches to disease management, personal public health and particular, as well as methods to assist patients in the diagnosis and treatment of the disease, drug use, and care needs. This information makes the nursing management process more scientific, standardized, and programmed, and provides nursing thoughts and measures for controlling and reducing or even eliminating the occurrences of COPD. This is a relevant reference. Tell us the dangers and risk factors of COPD so that appropriate nursing measures can be taken. And the next is reason 2. The literature also emphasizes the necessity of effective treatment and nursing management for patients with COPD, and analyzes its hazards and complications to prevent patients' health from being seriously affected. Reason 3. The respiratory nurse workforce in the UK provides a wide range of services, focusing primarily on nursing activities in the patient's home or accelerating the transfer of care from hospital to home. At the same time, the respiratory nurses team provides a wide range of services, and the most frequently provided services involve chronic disease management. These services model and the concept of optimal nursing management improve medical services and ensure the quality and safety of clinical care. Reason 4. The literature provides insight into the clinical challenges faced by respiratory nurses. It discusses the complicated workload and the pressure of nursing staff, the lack of hospital resources, the formalization of rules and regulations, and the lack of administrative support. It emphasizes the needs of nursing staff and strengthens the implementation of nursing management. Reason 5. Nursing management aims at the different links and angles of nursing work. and forms each nursing work into a continuous working process according to the reasonable procedure, which makes up the definition of traditional nursing. Nursing through the effective evaluation of the patient's condition and early detection of nursing problems and potential complications to implement effective intervention and ensure the safety of patients' lives.
How to use the literature on the scope of COPD, etiology, preventive measures, how to identify and treat COPD, and how to control, reduce or even eliminate COPD, and much information can be used in our nursing clinical practice to treat patients. Monitor patient's condition. Accurately record early urine output, blood pressure, respiration and pulse. Instructions for drug use. Explain the effects of drugs and methods needing attention to the patients. Instruct the patient to inject vaccines and take precautions. Provide oxygen therapy management. Explain the purpose, necessity, and the precautions of oxygen therapy to patients and their families. Quiet smoking. Active self-management, consciousness of patients. Smoking is the most important risk factor for COPD, which can cause structural and functional changes by destroying bronchi, aggravating airway inflammation and remodeling and producing inflammatory effects through the airway wall and lung parenchyma. Psychological management. Guide patients and their families to understand the occurrence, development process and treatment knowledge of disease, and treat the disease with a positive attitude to cooperate with treatment and care.
Give patients nutrition support and respiratory management. Keep respiratory treat unobstructed timely administer substitute aspiration to patients' COPD at a stable stage. Rehabilitation training. Assist patients to reposition regular. Tap patient chest. Promote summit drainage and ensure smooth drainage. Guide patients to prefer label reduction breathing. Abdominal breathing training. Exercise the patient's respiratory muscle function. Health education. Individual guidance, collective education, and multi-year courseware are taken increase patient health knowledge, correct patients' bad habits, eliminate disease, inducing factors, and stress risk prevention and management. How to use it? The literature also assess the current state of English nurse specialists help us to understand the current state of nursing staff, such as workload is big, lack of labor, and so on. As nursing students or as the future nursing managers, we need to change the current embarrassing situation and take effective measures, thus to reduce the work burden of nursing staff, provide patients with sufficient medical resource, especially nurse. Timely, effective relieve patients sample of dyspnea in our case. Ensure patient safety. Standardize nursing operation technology, so the theoretical knowledge of nursing for us. Be good at asking for support. Our new nurse has to learn to maintain mental health, anxiety, tension, anxiety, and other psychological state must be good at discovering time. Through the analysis of a self-sober, try to find out their psychological pressure of things and the things in your life and the working rule. Through the analysis and ask yourself consistently improve their psychological induced ability and actively find out the way to have limited stress. Constantly develop our nursing leadership and management skills and roles. Stress and disease-related training. Cultivate good working attitude and enhance nursing safety awareness and legal awareness. Pay attention to administrative management. Pay attention to rules and regulations. To guidance and promote the improvement of nurse quality so that the nurse work on the track of standardization and management producer provide support for the improvement of hardware factors, the updating of a hospital system, the service of nursing staffs.
I am May. I will introduce the practical challenges. It's about significant changes in the leadership roles of nursing in the care management of respiratory disorders. When nursing patients with respiratory disease, nursing work is complicated because both hospital nursing and community nursing need to be taken into account. The workload is large and the aging abroad force is serious, so there is a serious shortage of nursing staffs. Due to the lack of personnel, a group of nursing staff had to extend their working hours with serious workload, low or no overtime pay, and lack of administrative and financial support and subsidies, which often greatly reduce the enthusiasm of nursing staff, aggravating the loss of personnel and forming a vicious cycle. In addition, due to the heavy workload, occupational disease also occur nursing personnel, such as Parkinson's disease and rheumatism. As a clinic nursing specialist with strong leadership skills, while recognize and emphasize the importance of working with support teams, the role of respiratory care specialist is unclear, threatening a valuable nursing role and untapped potential for specialist nurses to provide quality care. Caregivers provide important support to patients to help them manage their chronic disease and continue to make a positive contribution to the inpatient care and an early discharge program for patients with COPD. However, despite evidence that respiratory care professionals provide professional and beneficial support to patients, research into the clinic and cost effectiveness of nursing-led care and service in respiratory medicine is still in its infancy. Due to time constraints, respiratory nurses may not be able to provide patients education and support for self-management. Its affects outcomes in patients with a variety of long-term conditions, including chronic obstructive pulmonary disease. These are our references. That's all. Thank you for watching.